Thank you one more time here. The program still this morning on ITV on independent television here in Benin City, Edo State, South Nigeria. I told you that we're going to be looking at the issue of COVID-19 one more time in Nigeria and to be precise in Edo State. Now the figures are still very much alarming, very disturbing, and it's still something that it still needs concerted efforts, your own efforts, my own efforts as a citizen, and of course the efforts of government to make sure that we fight COVID-19. And as it stands now in Nigeria, we have confirmed cases to be 112,004, while we have recovered cases in Nigeria, it's 9,939. For deaths, we have 1,449 records so far in the country in Nigeria. This is as at yesterday, the 19th day of January 2020. So we are awaiting the result for the 20th, that's today, because the result just keep on coming and it keep on coming, and it seems I don't know, it's very disturbing. I like what the Edo State government is doing, making sure that they really keep COVID-19 under control. I said it at my introduction that only yesterday the state government had to establish a task force. A task force team that's going around, the members of the team are going around the metropolis in Benin City, making sure that they enforce the wearing of face masks. People are not complying. People are not using their face masks. And at times when you see people put on their face masks, they just hang it, beneath their jaw. I don't know whether it's a facial accessory, whether it's something that you just adorn your face with. I don't know. You're supposed to wear it. You're supposed to wear it. It's supposed to protect you, not for you to use it to make a show of. I don't know. If you put it that way, then of course it's not going to protect you in any way. Well, to look at the COVID-19 situation one more time and assessing government intervention efforts, we're so privileged to have Dr. Pius Ononigwe, who is from the African Center for Disease Control, and he's also an epidemiologist, and he's supporting the Edo State government's response team, the Edo State COVID-19 response team. Dr. Pius, you're welcome to this program this morning on ITV.
Thank you so much for having me. Pleasure.
All right. Now, it's very disturbing to know that the records are going up high in Edo State in Nigeria. Now, let's start from, what do you think is responsible for this, records going on high about COVID-19?
Okay, thank you so much. Actually, this issue of COVID-19 pandemic has actually been a discussion that has been on for a very long time now. You recall that early last year, the pandemic was actually declared, and we have been actually as a state, as a nation, and also as a continent and globally fighting to make sure that this pandemic has been under control. But historically, we are aware that a pandemic or an outbreak of this magnitude, we are aware that it spreads so fast. We are aware that there are means of transmission. We are aware that there are also control measures. But the issue is this awareness, this understanding we have, how are we putting things in place to make sure we put them under control? The government has actually been doing a lot. The cooperation is what has not been so strong. And because at the point we understood that taking responsibility, which not only from government, from everyone, would be a win-win situation for putting this under control. So the question is, why did we get to this level, or why are the cases increasing? As at ending of, say, sometime October, November, nationally, the number of new cases we are having came down drastically, such that you could barely get one positive case in every 100 you tested. But all of a sudden, it started coming up. And it's not surprising. You recall that we had always warned that these non-pharmaceutical interventions, like you mentioned, use of face mask, hand wash, use of hand sanitizer, and also with a lot of things, physical distancing. Those are the measures that could delay how much number of cases we are recording. But you know, at a point, people relaxed. The belief people have about COVID-19 we have been struggling to make them understand that this is real. And before you know it, the cases started coming up. And because it's a pandemic, it's actually happening everywhere in the world. We started recording high number of cases from the Western world. All of a sudden, Africa started getting high number of cases. Nigeria followed suit, and also in Edo. So the reflection is uniform. Just to tell you that when you say it's a pandemic, it's indeed a pandemic. When you see it here, before you know it, it is there. So actually, the cases are rising because the virus, which spreads very fast, has gotten a free environment that supports it to spread, because we have not done so much in terms of ensuring that all these measures that can interrupt the spread have been put in place. But hopefully, in this second wave that we have entered, I think a lot of awareness is there. Initially, it was difficult for people to say they know someone who has been infected with COVID-19 in the first wave. But I can tell you now, in this second wave, because of the way the spread has been, because of the rising number of cases, increasing hospitalization and the rest, when you see about 5 people and ask them, do you know anyone who has had COVID-19? It's easier for you to get a yes from that. But that has actually made people to understand that this thing is not a joke. That what government has been saying is actually real. But my concern is that we shouldn't allow things to get to the level of we seeing it causing negative impact before we start taking measures. So the rise is expectantly going to be coming up until these measures are put in place. And at the end, I think vaccination is the last dot for it.
Okay. Now, before we talk about the vaccination, which we're told that Nigeria as a nation, it's on the verge of, starting its vaccination. And also, before we also look at some of the response measures put together by the Edo State government, in really trying to curb this COVID-19. Now, experts are of the opinion that the second wave of the COVID-19 the infection is exponential. It spreads almost 10 times the first wave. Now, what do you think is responsible for this? Is it the virus itself, the B117 that we have now, or still because of the way people, are still behaving?
Okay, I think that is
because people, you find lots of argument that is the virus, is the way people are behaving. So let's get it straight. What is really responsible for this exponential, growth of the virus?
Okay, I think this question you asked is very, very important, because we really need to understand why it is like this. Historically, we have had pandemics like this, the Spanish flu, and all of that we had. In the first wave, when the pandemic started early last year, we understand, in epidemiology, we try to understand the distribution, how the disease spreads, where it is spreading, which people are involved, what are the risk factors. And those information, we gather them, analyze, and use it to bring in control and preventive measures. So in the first wave, we recall that we know it came from the Western world, and even based on the data we have in the state, and concentrated mostly at the municipal, because you can understand that people travel from the UK, from the US. Obviously, they may not be going straight to the villages. They will also stay around the municipal. So we understood that the distribution was basically like that, and that is for the first wave. But over time, people started moving. Because movement is the most significant vehicle for human, that of which this virus moves. So, in first wave, it was restricted, although it was still widespread. But because of movement, was basically the people that that were affected were in the municipal. After a while, it has taken almost a year. This movement has gone, or the rural areas, people have traveled for burials. Even the New Year, the Christmas, so much travel has happened. So the virus has now become sure-footed. Even though the tempo went down in November, a flame that has actually spread when it has little opportunity. So now it's no longer coming from a concentrated area. it is coming from the it's now widespread. That is why we are effortlessly having a lot of cases, because it is now sure-footed. That is what happens, the difference between the first and the second wave. So that alone will mean that we have a lot of people infected, because it's no longer, the distribution is no longer concentrated. The distribution is now widespread. Number two, in the first wave, there was this fear. There were people cooperated because everybody knows something that has just come new. Everybody was working hard to see what to do. There was lockdown, people cooperated. People were asked to do this, they obeyed. In the second wave, people have got tired. And that is why we are so much worried. You don't get tired when the war is changing gear, when the momentum is changing. It's supposed to be the reverse. But in second wave, you see that people have said, no, we are not ready for this again. And because of that, the measures that would have interrupted this spread are no longer being put in place. Okay, and finally, most importantly, in the variants, you know, the virus as it replicates in the population,
the B117,
the mutants, and those ones could be more infectious or more virulent. But what we are seeing is that this one is more infectious, meaning that it can spread faster than the previous, and affecting even more age bracket than it did previously.
Okay. So now let's get a little bit of records down. Now, experts said that the B117 actually was first discovered sometime in June at the Madonna University in Osun State. Now, how come we didn't have you guys from the African Center for Disease Control, not even the NCDC, no warning? You know, only for scientists to say that as at June last year, we already had this B117 before the news came that it came from the UK.
Yeah, actually, you recall that the response has actually been coordinated. There is one thing about this response, there is serious coordination, collaboration, cooperation, and communication. So the issue of the variants, these strains developing, actually the warning has been there because we understand how this virus moves. There has been actually speculation that there will be mutation. There will be different strains emanating as far as there is replication. And recall that is a novel virus. So the issue is that the one that was traced to the UK, at the point US said they are not going to shut down because if it was in June, we have been moving. So the issue is that there has been pre-information about these mutants or these new strains. But the point is that because the coordination was centered in trying to ensure that people do what they needed to do in terms of prevention, and because people were tired of locking down, I don't know if you're getting it. So the strains were there. There was warning, there was notices about this new strain coming on board. And the researchers were also doing a lot of work. But the bottom line is that the genomic sequencing that actually helped to bring out these new strains were actually done alongside the response that was going on.
For the first wave. For
the first wave.
Yeah.
And the information was there. It was not that, it's not a new thing to us that we have new strain. Okay. What we're interested in, how do we first ensure that people do the things that will make this spread not to go on? It's more important. As the scientists were doing their own, this information was also reviewed. So it's a collaboration. People, because the response is one of the biggest so far. So a lot of information are being brought out and shared. So we are aware. The target was always to treat, to test, trace, and treat. Okay. Because these are the major things that we need to do to interrupt the response, apart from the non-pharmaceutical interventions.
Okay. Now, you are in the team of the Edo State Response Team here in Benin City.
Yes.
And by profession, you are an epidemiologist.
Yep.
Now, you said something a while ago that there seems to be a certain age that seems to be more at risk for the second variant. You want to establish that more?
Okay. Based on what we know, because we are here in Edo State, or also elsewhere, especially here, because we are very much data-driven.
Okay.
We use the information we generate
from Edo State.
Yeah. To devise our own response strategies for response.
Okay.
Knowing full well that there are minimum standards or minimum expectation from, because the virus is actually generic, it's a general, it's affecting everywhere.
Okay.
But it's always important that we use what is peculiar to us.
In Edo State,
knowing full well that there are general understanding about the virus to direct responses. So what we have seen here in Edo is that just like it is in other areas that have actually checked, we found out that like in the first wave, the age group maybe 31 to 40 were the most affected.
31 to 40. Okay.
Or if you like, you can say age group 31 to maybe 50.
Irrespective of gender.
Irrespective of gender. Gender was almost, there's no significant difference between gender. There was no, although the males were a bit more affected. Okay. It was about 47, 53. So it's not, the difference was not significant.
That's for the first strain.
For the first strain. Okay. And which we are also seeing in the second. But the only difference now is that more age groups, including children, are now being affected. That's to tell you that when we have mutant genes, it could be more infectious, meaning that it does not know age bracket again. It's as going ahead, infecting as much people that get exposed. So that has actually defined some of the decisions that have been taken in the state, because the state government is very, very interested, very, very particular about what is the outcome of what is happening. Because that's the best way to take decision. Yeah. You don't take decision because you wake up. The government has a technical team of experts. We always sit every morning to analyze what has happened in the past 24 hours. Then that will determine, we now evaluate, critique, and say, okay, because of this, how do we justify this decision, this action, this policy that is to be made? And that has actually helped. That's why Edo State has actually done so well in terms of this response, because when there is political will, there are people who are there who understand the subject matter experts are there giving opportunity to make their contribution, and their contributions are used to take decision. Then you see that no matter how fierce the battle is, it's always going to be under control. I think the only missing link, the impact the population played, the masses play, because it's a win-win situation. You do your own. If they don't do their own, it tries to bastardize the whole effort.
Now, I'm just wondering, Dr. Pius, how you are able to go through the problems associated with testing in Benin City here, because you discover that people are still, they still feel somehow about this COVID-19. I told you about yesterday, I was in town. You still find people wearing their face masks, hanging it beneath their jaw and all that. So how are people responding? Because without the testing, you can't know who has the virus. How are you coping?
Okay, I think presently we have actually come up in the state to ramp up testing. I think last year, Edo State was one of the states that did aggressive testing. Because in the testing, we tried to see how we could test a significant part of the population. And now we're trying to do the same thing. We want to, in the next 3 months, get at least 1% of the population of Edo. Now we have done over, in Edo State, we have done over 25,000 tests.
Over 25,000 tests?
And the target is in the next 3 months. Let us at least, that's the minimum, get up to another 25,000 to make it 50,000, which is about 1% of a population of about 5 million people. Yeah. So if we have that 1%, that will also help us to understand more. The number of tests would have given us a very clear picture of what is happening, and also how government should take a decision. And also, it will help to interrupt spread.
The spread.
Then, but what I want to say about this, what we are doing is that we are now decentralizing. Remember, we understand very clearly how this second wave moves. Distribution is widespread. So we are making sure that even those people at the rural areas are being tested. So a lot of community sensitization, community mobilization, using the community informants, because we have done well in terms of immunization. So we have grassroots structure. So we are using these people to begin to also engage people to understand the importance of testing. And we also have surveillance officers that go ahead, investigating rumors, signals, sensitizing people. We have a lot of the state response, the support from the Africa CDC, WHO partners. You know, there's strong collaboration in the state. So these are people are at the grassroots now, trying to see how we can mop up testing so that the testing will not only come from the municipal, should come from everywhere, because we know that the virus is most likely to be everywhere. In this second wave. So these are the things that we are doing in the state.
Okay, I want to emphasize more on government's intervention, the Edo State government intervention, the impact it's having on the populace as it relates to this COVID-19. I want to expatiate more on that, because you are on ground,
yes.
So you are going around, so you know what's going on.
Okay, so the intervention, the intervention that the state government have actually put in place are highly multifaceted. Okay. Let me start from the intervention that has to do with testing. I just talked about that. So I've talked about how we want to get minimum. We are targeting more, but minimum of 1%. That's 25,000 tests in the coming days or in the coming months. Then also the issue of training, because you remember that the healthcare workers are at the front line, and the virus is changing style. You know, so there have been a lot of trainings for healthcare workers on how to best fight this infection without also getting infected. Okay. Then there's a lot of intervention in terms of treatment, because Edo State has 4 treatment facilities: the Ura Specialist Hospital, the University of Benin Teaching Hospital, and the Stella Obasanjo. And
they are functional?
They are functional. In fact, the Stella Obasanjo, as at yesterday we went for assessment, has up to 300 bed space, because hospitalization rate has increased, telling you that something is really happening. But we are not actually trying to be taken away. We have already envisaged that. So in the terms of treatment, the treatment center is very much ready to take as much as up to 300 bed spaces. Then are we talking about the surveillance? Because surveillance is very key. The state government has actually increased the number of contact tracers. We are also having support from partners. And these contact tracers are supposed to ensure that every confirmed case is traced, so that we'll be able to make sure that those people who have had contact with them are advised on what to do. So that possibly, because if someone has COVID-19 and the person does not do anything about it, it's possible you could infect as much as 2, and the person infects 3. Before you know it, in a 3 incubation cycle, could have up to 18 people.
Now, these measures, are they applicable to rural settings?
Yes, because I told you that we work with data. We have understood that in this second wave, there are high possibility that this virus has gone to the rural setting. So every measure we put in place now in the state, we ask ourselves, how is it reflected in the rural setting? If it is like Auchi, we are beginning to see that cases may begin to come in the Edo North axis.
Why?
So because obviously I've said that in second waves, the distribution is widespread because of what we know. Okay. And also we are beginning to see pockets of cases, unlike we saw in Edo North. So now we are envisaging a situation whereby it will take a lot of distance to go to Ira Specialist Hospital. So the Aoshi General Hospital is now being put in place for receiving of patients. Yeah. So these are the interventions that will also touch every nook and cranny of the state, which the state government is actually carefully putting in place.
Okay. Now, you talked about data. From your data in Edo State, how would you want to describe the survival rates of children? Because that seems to be the concern of some parents. I mean, against the backdrop that children by February that they are supposed to be going back to school.
Okay. Based on the survival rates of children.
Especially as it relates to this B117.
Yes.
In the first phase, we were told that children have more survival rates. Yes. So this second, is it the same thing?
Yes, our concern basically is not the children's survival rate, because it will still be high. But the point is this: if they are the vehicle in which the teachers, the parents at home will have the virus, will contract the virus, then the parents who may have comorbidity or underlying condition, or maybe above a particular age that is at risk, 50 and above, that parent contracts it, which, because you know it spread very fast, and it could not, the person may not survive it, the child may survive. I don't know if you are getting the point. So we are interested in someone who is capable of carrying this virus and giving it to another person. Children may survive, because what we have found out is that if you present early, you have 99% chance, up to 99% chance of surviving. Where the problem is when people do not present early. When they present late, more than 60% to 70% of the deaths we have recorded are from people who do not present early. So that is why early presentation. That's why somebody may make an argument and say 99% of people that have COVID-19 will survive. It's only 1%. That's 1 in 100 that may not survive. But the problem is most people do not present early, thereby making that probability to also increase. That's now, probability of dying.
Yeah, doctor, the issue of presenting early, you notice that the symptoms, I mean, it's the dry weather, it's dusty weather, it's hazy weather. This is the time we normally have common cold. So for most people, they may see the symptom of common cold as just, it's not enough to say that this is COVID-19. Is that not the challenge? In other words, how do we know that, look, these symptoms are COVID-19 so that we present early?
Okay, I think the first thing we are trying to make people understand is have this high index of suspicion. High index of suspicion in the sense that when you see something that has respiratory resemblance, maybe you have cough, you have flu, you have fever. We have testing centers all over. You present yourself, you are really prioritized for testing. So when you are tested and you obviously after 48 hours maximum, your result comes out positive, you start treatment. And you have already fallen into that 99% category of people that will survive. But what we have is people who, even when the information is there, they don't want to believe this thing is happening.
Now, because people probably are not prepared for the psychological effects it may have on them. So how are you guys helping people to know that, look, it's not a death sentence? How are you doing that?
What we are doing, we are doing it at the case management level. That's at the level where someone has been, a sample is being collected. We have trained our staff on psychosocial support.
Okay.
Trying to make them, even at that point, when their samples will be collected, that this thing is, your result will be out, try to tell them about that COVID is not what we painted.
What kind of testing are you guys doing now? Is it a blood sample testing?
Okay, what we are doing is, which is the actual recommended testing for the standard for COVID-19 is the PCR test. It's swabbing. Okay. The polymerase chain reaction test is a molecular test.
Okay.
Whereby if it says it's COVID-19, it's almost impossible that it can never be COVID-19. Okay. So that is the level we are going.
Is it the one that the
swab? It can be nasal. Yes, the nasal and the oral swab. It's actually swab that you got. So
and the result comes out within?
The result comes out sometimes within 24 hours, 48 hours.
Okay.
And we are working hard to ensure that our turnaround time is very high. So, and the only thing that makes turnaround time not so good is the logistics, which the government has a logistics team headed by the deputy governor himself. So tell you how the political way we are talking about. So the issue of logistics, we always try to make sure it doesn't occur, because that's the only thing that can delay the outcome of the test. So when that is done, someone knows already that this is actually the situation, and treatment commences immediately. And we are talking about the psychosocial aspect.
Yeah.
So at the testing level, we do that. Even at the case management level, those the doctors, the person that will be attending to those that have been confirmed positive, we have trained them on how to make them understand that it's not what the society, the wrong impression the society creates that we have. All we are doing is we are in a world that all of us are trying to survive. So they try to make them understand that it does not kill. As far as you do this, you do that. And we have, because of that, we devised what we call the home-based care, where the case manager assesses the confirmed case and finds out if it's convenient for the person to even receive care at home. So we have ambulance that will be going to meet those that, after assessment, they are fit for home care, which is basically if they are not aged, they don't show symptoms, and the environment they stay can support them staying alone.
How safe is that when somebody is supposed to be isolated? I mean, somebody that is down with COVID-19, then you say home care.
Yeah, home care was actually devised when the system was almost becoming overburdened. That is when
the facilities.
Yes. So we had to devise, because we know that you recall that more than 80% of people that have COVID-19 are asymptomatic. So, you know, in response, we have to balance a lot of things. We now said, okay, if people can stay at home, understand that they need to stay at home, and care will be given to them. Because most times their problem is that I am not sick, and you have taken me to the hospital. So when they are at home, they cooperate, you monitor them, because sometimes the person who does not show symptom in the course of the infection may come down. So that monitor will move the person to the treatment center. Okay. So most importantly, there is this connection, irrespective of wherever you are, whichever care you are getting. Okay.
Now, I've been speaking with Dr. Pius Omonigwe, who is from the African Center for Disease Control. He's also an epidemiologist by profession, and he's in the Edo State response team, fighting COVID-19 in Edo State. Now, schools are going to be resuming on the 1st of February. That's about, today is 20 now. We're talking about another 11 to 12 days. I want to believe that the state government is engaging you guys to see that schools are safe enough for resumption in this regard.
Okay. Actually, in terms of engagement, we are the government of Edo State, as it regards to COVID-19 response, actually is all encompassing. Everybody, I talked about, there is strong collaboration, there is strong cooperation, there is strong coordination, and there is strong communication. So this is actually what we have been doing. In fact, before now, the governor himself constituted a technical committee to advise on the guidelines for all these mass gatherings, including schools. So the committee sat down, used what we have globally, what we have nationally, and what we have in the state to adapt measures that will help to, because the target is, let us make sure that we interrupt this spread, either from the government axis, from the axis of the masses. So we have actually been working the state primary, the SUBEB, the Ministry of Education, the Ministry of Health. We have been seriously working. Risk assessment is being conducted in schools as I speak, because we really need to make sure that at least up to 70% of these schools are ready before the resumption. And that's why, that was the justification.
And the response, is it impressive?
Yes, it is impressive, because just like I told you, once the political will is there, because if you know that you are going to give a report on what a task that His Excellency has given you the next day, because he meets with us every morning, everybody works. Everybody.
I like the way you talk. You are not a politician, and yet you are so much.
Yeah.
Yes. I mean, you are not supporting the political party here. So
yes. It's always good when you see things work, because I've supported a lot of states. Yeah. But when I see, when you see something that is good, you have to commend it. And actually, when we come to the state, we expect this kind of resistance, because the people we are pushing them to do the right thing. But now you see people trying to push themselves to do the right thing, and you join them. So you can't but help to talk about it, and it's also seen everywhere. So I think with what we are doing in the state, if it's sustained, which I believe, we are going to make a lot of progress as far as COVID-19 fight is concerned.
All right, now I'm going to let you talk to the people so that you give them one or two advice. In any case, let's try to, you can drop your SMS, your short SMS or your short WhatsApp on 08024645409, 08024645409. 08024645409. Remember, we're talking about COVID-19, assessing government intervention effort. Now, this government intervention efforts are efforts that we are seeing everywhere. I've seen the task force that the state government has, established. I've seen them moving around, and the way that they talk to you in a very, acceptable manner. They advise you to wear your face mask. They don't even try to impose it upon you, you know, that you must wear this thing. They talk to you in such a way that you really see the need for you to wear your fixed one. So you drop your comments, drop your short line on 08024645409, 08024645409. Doctor, talk to the people about COVID-19 one more time.
Okay, I think just like drawing from the last comment you made, the government taking time to walk around, trying to sensitize people, because I think people need to understand why they need to do what they have to do. And that understanding is that this COVID-19 is real. People are being hospitalized. Oxygen supply is actually an issue. I wouldn't want to see anyone in the asking for oxygen that you can freely get, I can freely get as I am now. And COVID-19 is proving that this thing is going to happen, and we don't want it to happen. And the only way is for us to understand that what government is doing is actually for our own good. What government is saying, wear face masks, not because they want to impose it on us, because they have seen that that is the only thing that will save the lives of their people. So let us wear a face mask. Let us always ensure that we physically distance and maintain physical distancing. Let's always make sure that we wash our hands with soap or use hand sanitizer. Let us avoid crowded places. Let us avoid close contact, and let us avoid closed spaces. And if we are able to do all these things and cooperate with what the COVID-19 protocols, as government brings them out, I think we are going to make a lot of headway in this fight.
Okay. Now, the vaccines that Nigeria is expecting any moment from now, we're told that is the Pfizer vaccine.
Yes.
So many literature, you know, have been going around about the vaccine, and there's so many reactions and counter reactions. NAFDAC has said that if not until they certify those vaccines, that they will not put a pass on it as good for consumption. I don't know what your take is like from your own point. Your own, that's the Africa Center for Disease Control. What are your takes on the Pfizer vaccine?
Okay, actually, the WHO and the African Union have actually been working hard to make sure, because we knew before time that when these vaccines are available, the superpowers, so-called superpower, will take them all. So there has been this call, when these vaccines are available, let it be able to reach the low, middle and income countries, of which Africa falls in that category. So presently, there's no vaccine rollout in Africa, but there are a lot of discussions.
Okay.
Like in Nigeria, the Pfizer BioNTech mRNA vaccine has actually been 100,000 doses will be coming to Nigeria, according to the boss for the National Primary Healthcare Development Agency, which is actually the institution that oversees vaccine administration in Nigeria. So there are a lot of talks about that, and the 100,000 doses that will be coming is actually the one that has minus 70 degree Celsius storage. So that minus 70 degree Celsius storage, we have confirmed that we have the ultra chain store that can house it, and deployment will commence immediately it comes to Nigeria. But the point,
you guys going around to make sure that states also have these facilities? Take, for example, Edo State. Bearing in mind that we have issue with power, we have the facilities to store these vaccines.
Yes, the fact. I want to make some quick points on this. The vaccine is stored based on the assessment done so far. We have the capacity to store the vaccine at even minus 80 degrees Celsius at the central ultra cold store in Nigeria. Now, when the vaccine leaves the cold ultra cold store, it can stay up to 5 days at our normal plus 2 to 8 degrees Celsius. I don't forget what I'm saying.
You mean this weather condition, this hot weather condition?
No, we have succeeded. We just eliminated polio, you are aware, in Nigeria. It's the same vaccine, it's the same temperature, plus 2 to 8 degrees Celsius. We have that. It is not debatable. In fact, it's something that we have built. It's just like when you say an advantage you have. You don't struggle to do that. You don't need any investment on that, because we have done measles, we have been doing polio, we have been doing a lot of yellow fever, and these things have been maintained under that. So The only good thing that I want us to pick from here is that he can stay 5 days without any problem under +2 to 8. If he leaves the Central Coast or at -70.
On that +2, that's on the high side. Then
Yes.
-8.
Minus is a very low temperature.
Side,
yeah. So we have the capacity to. So what we need to do now is the logistics to deploy them from the central point located in some parts of the country.
Points where they are needed.
And use within 5 days.
Yeah.
It's very possible. In fact, if I had 3 days, I would still, based on what we have.
The Edo State government, are they ready for this?
Very much ready.
Okay.
Very much ready, because a lot of discussions have started in the state primary healthcare development agency that's actually been doing this work.
Okay.
Yeah, they have already been trainings, although the national is, in the coming week, we deploy a lot of training, but we have started sensitizing the people. We have started actually making the people ready. But remember, this one is only for 50,000 Nigerians. And it actually prioritized for the healthcare workers.
That's the frontliners.
The frontliners, because they need to be strong to fight the battle.
Yeah.
But there are plans to bring more vaccines that are not in this category of -70 degrees Celsius. There are discussions with India, with Russia, for vaccines that can be stored
at high temperature.
At high temperature that we are used to. And these discussions are actually going on through the African Union, WHO. So we are really making headway. So in the coming days, by end of this first quarter, would have known what conclusion.
All right, Doctor, thank you so much. I've been speaking with Dr. Pius Omonigwe from Africa Center for Disease Control, and also an epidemiologist by profession, supporting the Edo State government on the fight against COVID-19. Now, from what the doctor said, there's no doubt that the Edo State government is full ready and fighting COVID-19 in Edo State. So all we need to do as citizens of the state is to make sure that we support the government, because this government cannot be doing it alone. The government needs your support as a citizen. So when the government says that keep the safety protocols intact, always keep them. Go around with your face mask. Don't leave your home without your face mask. It's an offense. It is an offense as it stands now. There's a mobile court going around in Benin City, and of course, once you are caught without a face mask, then of course you are going to be convicted. In the words of the deputy governor, he said that once you are convicted, you now become a victim for COVID-19, and you become a convict of of the law, which is not a palatable story at all. Thank you so much, Doctor, for finding time to come on this program today. Thank you so much.
Thank you so much. It's my pleasure.
The program still this morning on ITV. We'll take a short pause now so that all the segments will reach your way. Please stay tuned.